My family supported me hugely. I am the first person from my family to attend university, let alone medical school. My mother, my father, and my grandmother. My grandmother was my greatest supporter. She came to all of my concerts, all of my productions, all of my exam results, and she was cheering me on every step of the way.
Welcome everyone with your program Peels of Union, who invade the most successful story and person here in UAE. Today from Abu Dhabi City with Dr. Tracey Sims. Welcome, doctor.
Thank you so much.
We are so happy to meet you today.
Thank you very much for this opportunity to talk with you.
So, doctor, from the beginning, we need to know more details about you to present you for everyone.
Okay, so my name is Dr. Tracey Sims and I'm from the UK. I've done most of my career and my training in the UK, and I've been in the UAE now for 3 years.
So, doctor, we need to know now more details about your career, your beginning, what you do, like graduation.
Okay, so I was brought up in the northwest of the United Kingdom, just outside a city called Liverpool, and I was very fortunate that my grandmother was a nursing sister at a psychiatric hospital, and she looked after lots of long stay patients, and she inspired me to want to care, to want to go into the world and make things better, particularly for women. So I applied to the University of Cambridge, which I was very fortunate to be offered a prestigious place, and I graduated from the University of Cambridge Medical School in 1997.
So we know that the successful story is not easy. All the person have this challenge of life. What's your challenge, doctor?
My challenge, my huge challenge, is getting the balance right between my career and my beloved family. I'm very fortunate to be married with 2 children, 2 teenagers now, and in fact my son has just gone to medical school. And I've been very conscious throughout my career of always making sure that I was a present mother for my children in the home, as well as all the time pushing to push the boundaries of what was possible for my patients.
So, doctor, it's easy, this balance of responsibility to be the mother, the doctor. Also, you have this work is hard here in the hospital with the women. So it's easy to do this balance?
No, it's not easy. It's a daily challenge to get the balance right. I think there are 2 ways to look at it. There's looking at it in the long term and making sure that I plan, that I have enough opportunities to develop my career, as well as planning to ensure that I'm available and present both physically and emotionally for my children as they go through their developmental stages. And then there's the day-to-day challenges, the day-to-day things of making sure my children get to where they need to be at the right time, that I'm there for them when they have issues with their schooling and their friends, but all the time I'm pushing and pushing to educate myself more, to learn more, to get more skills. And whether that means flying across the world or across the UAE to go to courses and conferences and present and get more teaching, or whether it means having time to read my journals and to catch up on the latest advances. It's all important, and it's a daily challenge.
So before 3 years, you chose this country for life, for work, for success, for family, for everything. So why UAE? Why you choose exactly UAE, not another country?
UAE is a wonderful country. UAE is a forward-looking country that embraces innovation and has put at the forefront of their development the importance of health and of women. And this is one of the major things that attracts me to UAE. It's also an incredibly safe environment for my family. I have a teenage son and a teenage daughter, and it's a very safe place for them to be.
So what do you think, doctor, about the healthcare service for women here in UAE?
I think that the healthcare service here for women in the UAE is constantly developing, is willing to take on new ideas and new challenges, and to look in depth at the needs of the women here in the country, both the citizens and the residents, on a daily basis. And this is what excites me about UAE. We are using here in the clinic innovative technology, and I have found here in UAE the healthcare system enthusiastic, willing, wanting to innovate, wanting to push what is possible for women's well-being.
Today, UAE or Abu Dhabi, the capital, like the best destination for medical tourism. Many patients from all the world choose this place for the health care. So if you have some patient from other countries, what's her opinion about this country, about the health care in hospital at Corniche?
Yeah, we have women who travel to come to Abu Dhabi to receive treatment, and particularly to Corniche Hospital. And the women who travel here find it an easy process to be able to come to UAE. UAE is welcoming to them and hosts them extremely well while they undergo treatment here. And the treatment can be carried out efficiently and in a timely fashion and in a safe fashion. So there's the element of trust and also of convenience.
The technology, doctor, it will be in all the side of our life. Also in the healthcare or the medical system, we have this technology. From your specialty, doctor, how using the technology?
So we are using here in the clinic a number of energy-based devices. One of the devices that we use has been specifically innovated for the care of women who have urinary incontinence and pelvic organ prolapse. It is high intensity focused electromagnetic pelvic floor strengthening, or HIFM for short. This treatment is an extremely powerful treatment to strengthen up the muscles of the pelvic floor, and so improve the support of the bladder and also of the vagina, so helping with urinary incontinence and prolapse. The great thing about this treatment is that it's non-invasive and it's very safe. Women come for this treatment. Usually they come for 6 half-hour sessions, and all they have to do is to sit on the device, which is affectionately known as the chair, sit on the device fully closed for 28 minutes at a time. And the results that we get with this are astounding and life-changing for women. A woman can go from a situation where she cannot walk across the park or the car park without losing control of her bladder, to 2 weeks later being fully continent and able to move freely, play with her children, attend to her career at ease. And this is truly life-changing for a woman.
Doctor, if I ask you about the hospital at Corniche, the department of aesthetic here, what you have like a service for the women? More details about all the person who see us in the episode.
Yes, we're in a great position here at Corniche Hospital for offering a wide range of energy-based aesthetics. So we're offering intimate rejuvenation with fractionated CO2, a procedure known as the Mona Lisa touch, and with radiofrequency, a procedure known as the Ultrafem 360. So because we have multiple modalities of energy-based treatment for intimate rejuvenation for women, we can offer efficient packages to get them the very best results here within the clinic on an outpatient basis. We also use our energy-based devices in a wider way, such that we treat the face, we treat the body. We can do non-invasive facelifting with radiofrequency, skin resurfacing with using the latest techniques like cool peeling with fractionated CO2, which has minimal downtime. And we also offer completely painless, highly effective laser hair removal, which is extremely popular in the local population here.
Doctor, if I ask you about the success from your side after this experience that you have in the country before also coming for UAE, what means worth success?
Success for me means being able to offer the women who are my patients the most effective, latest treatments that make a genuine and positive difference to their daily lives and make them healthier, happier, with improved well-being, whilst at the same time being comfortable and safe with my family.
This is your message for the women who follow us on TV?
Absolutely. My message for women here in Abu Dhabi is to not suffer in silence, to not be afraid of coming forwards, that there are things that we can do to help them with their intimate issues, that things can be better for them, that their well-being can be improved.
Doctor, today you are like example for many doctors that you have this patient to be in UAE, to be in this level. So from your side, we need a motivation message for the new doctors from your side directly.
I think my motivational message would be, having practiced for in excess of 20 years, is when it's really, really hard, and it's going to be really, really hard on many occasions, to keep going. And when you're tired, don't quit, take a rest. And after you've rested, get back to it. Because it's really important to keep the focus on what we can do to help our patients. And that's what gives the satisfaction, and that's what keeps us going.
Doctor, today you have 3 years in UAE. I think that is your second home.
Yes.
Your stability, your family also here in this country. So your message for UAE, for the all leaders or the person who help you here in this country?
I am so thankful to the leaders of the UAE who support consistently and continuously innovation and progress in healthcare in this very forward-looking, caring country. So I have huge gratitude and thanks to the leaders of the UAE who support my work here in Corniche Hospital, and Corniche Hospital as a wider community and all of the healthcare sector throughout the UAE.
Dr. Tracey Sims, we are so happy to meet you today, like a great example of doctor, of mother also. Thank you so much. Wish you all the best, doctor.
Thank you so much.
Everyone, thank you so much. See you next week with Pearls of Union program. Bye bye.